The MedBricks webcast is focused on bringing distinguished Indians and others from diverse fields of science, medicine, technology, and philosophy to learn from each other and to create a new understandings and foster new ideas related to healthcare. Today, my guests are the authors of the newly released book on Amazon, Beyond COVID-19 Pandemic, by Dr. Joseph Chalil and Ambassador Pradeep Kapur. Here is my guest host, Dr. Ashna Parti, a pain medicine physician from Atlanta. Dr. Joseph Chalil is the author of several scientific and research papers and serves as the chairman of the Indo-American Press Club, the largest ethnic Indian American media forum. He is also the chairman of the Complex Health Systems Advisory Board, H. Wayne Huizenga College of Business and Entrepreneurship at Nova Southern University in Florida. Dr. Chalil is an expert in U.S. healthcare policy and a strong advocate for patient-centered care. Ambassador Pradeep Kapur is an acknowledged luminary diplomat with a distinguished career working with the leaders and policymakers around the world. He was Ambassador of India and is Secretary at the Indian Ministry of External Affairs. Presently, he is Executive Director of Smart Village Development Fund.
Thanks. So basically, one of the questions I have, given what we just talked about, you're talking about building infrastructure. All around, at least here in Atlanta, and I believe in other parts of the country, you're seeing less hospitals. You're not seeing more hospitals. And what are you going to say to those people that, hey, our hospitals aren't profitable, they have to close. If we build more, how are we going to keep them open?
That's a very interesting question. So, ultimately what we propose is a multi-payer system. So we have over 3,200 counties in this country, including what's in Puerto Rico, what's in islands outside. So if we have a county hospital in every county offering essential services, ultimately what we're talking about is annual physical exams, preventive maintenance tests, management of chronic diseases, because that's a big burden on everybody. Let's say if you're a diabetic, and then how do we go get your insulin? How do we go get your blood sugar checked? How do we make sure you have an annual eye exam or a foot exam or things like that? So those things should be essential, should be covered for free. But then we talk about creating the private system more competitive. So they are very admin heavy, and the doctors are not in charge. So ultimately, if we can get the doctors in charge, if we take away the certificate of need laws to build new facilities, and the facilities themselves become more competitive, for profit, competing with each other. And of course, you might have few might close, but everybody will have coverage or access to care.
That I feel that healthcare should be a right for everybody. And how would you go about convincing the capitalists of this country that by following Canada, the UK, India, trying to model those systems, how would that not be a socialist system?
That's a tough question to answer.
I think that's going to be the biggest challenge.
I know.
Doing something like this.
Because we've been stuck with this pandemic, everything has been exposed. What's been happening is what's currently ongoing, it's not working. So it's time we need to rethink the way to plan forward and how to be ready for them. So it's not about keeping all the lobbyist group happy. This may not be, again, this is not a pro anybody book. This is a pro patient book. Ultimately, we want to make sure the patient's in charge. If you look into the chapter 8, it's all about empowering the patient to be his or her own CEOs of their body and their health system. So from starting with patient-controlled medical records to patient-owned enhanced health savings account to pay for it, and they have access to care for the private system or the public system or essential things. Ultimately, if we can decouple health insurance from employment in this country, imagine how much boom it's going to happen to the businesses here. So if how many new businesses will start because employees are not stuck to their employment, and they can jump out and get coverage through, like it'll be like your car insurance. You take it with you, it's yours, not like tied by my employer.
What do you feel are some of the faults in those systems, and what can, in this evolutionary process of change that's being proposed, what are the faults in those systems and how to prevent that here?
The requirements primarily in this system, the proposal is that it requires huge investment. When we're talking about $2 trillion, $3 trillion stimulus plans, building 3,000 hospitals countrywide and changing the system may not be that big a deal, because it's going to produce employment to a lot of people. Make it happen. It'll provide access to care for everybody, and we'll have something to show for the next decades to come. So we'll be ready for it. But we need to make sure that the cost is contained while we help innovation. So we don't want to stop companies from creating new medicines for cancer or new surgeries for other things. So it needs to be a balanced act. So it's not a socialist medicine. It's a balanced act between the private and the public together, working together for the benefit of patients.
Do you feel the technology is a threat to you as a physician? Because Silicon Valley is definitely wanted to make waves inside the healthcare system. They think they want to replace with the computers, the robotics and all those AI-based systems. They like to replace doctors eventually. That's what they're trying to do. So do you feel that threat?
Yes and no. I can definitely say my practice at the moment is practicing, about anywhere from 20 to 30% in the office, and the rest is telehealth. And in what I do in pain management, it has made things very challenging. And I'm sure that in other colleagues I've talked to that aren't even medicine have had challenges working remotely doing telehealth. If I've got somebody, who's got back pain, and that's what I see most of, and particularly someone who's a poor historian, it's very difficult to get an idea on what might be the best approach to treat them. And in our country, as you know, there's an opiate pandemic. So that's also been a big challenge is, hey, I've got pain, can you write me this? And getting patients to monitor compliance in the telehealth world is very challenging as well. So I can say there's goods and bads.
So technology is a very important component, Mr. Raju, in the sense that I did technology, I did electrical engineering, and at that stage we also did some biomedical engineering. That was just the start of biomedical engineering in India when IIT Delhi started this department for the first time in India. So I see a lot of change in the world in terms of every aspect of life, every discipline of study has been enhanced by technology, has been facilitated by technology, and this is only going to increase with time. So similarly in medicine, already we see a lot of inroads into medicine, but like as Dr. Chalil said, the medical field is about 10 years behind. We have discussed this in the book also, where we have said that, but it is not something which will be a permanent feature of the medical field.
I'm going to ask you, in your book, you said that the United States is a reactive care, which is sick care. Well-being is not there. It's not part of the HMOs. It's not part of any insurance system. It's mostly, in fact. How do you transform such a complex, Dr. Chalil, how do you transform that kind of a complex structure, just embedded structure like sick care to well-being care?
It is absolutely correct that in America we call healthcare, which is really a disease care system or a sick care system. I'm pretty sure somebody very good at marketing must have named it that. We are very good at naming things very good, like we call it Affordable Care Act, when it's really unaffordable. to start with. So we have very good marketers. America and the free markets are very good in marketing, making people believe what it is not. But transforming it to really caring for health is that's what the whole grand plan is all about. So how do we make the current healthcare system or disease care system, whatever you want to call it, and how do we make it truly careful about or care about somebody's health? So we need to have few things. We need to bring access to care, as we mentioned earlier, with Ambassador was mentioning as well. We need to make sure that there's competition in which and technology coming in place to enhance what the patients can and do, and what can they know, what can they find out on internet about things like that. And the main thing about making truly a healthcare system is changing the patient behavior. How do we modify, like what the credit system of America has modified using the credit score? People tend to pay back the loans on time. They pay on a monthly, whatever, debts they have. So because they know they get penalized. And then people with good score are rewarded with lower interest rates. Similar here with patients with good consumer health score should have some reward. So it's a complex problem which will have complex solutions. What we have is some ideas of what can be done, but it is a conversation we want to have like this.
This is over dependency on China. Is there anything alternative process, Ambassador Kapur and Chalil, Dr. Chalil, that is there any process India and the United States get together to start a coalition of medical devices? India as a human capital and the United States as infrastructure. Can we do that? Combine these two together, can start a manufacturing coalition, like a similar to Gandhi's movement, Swadeshi cottage industry, like 3D printers. You can do that with 3D printers. You can print out all the vital sign kits. Can we do with the human capital with India and the United States infrastructure and the knowledge of that systems? So can we coalition? Can we start a coalition to really serve the entire world? Ambassador Kapur.
Thank you, Mr. Raju. I've been waiting for that sort of question because we have discussed about the role of China also in the book 29. So how do you now envision the future? How do you visualize the future? So that is one aspect where you have said that India and US working together, but there are also other ways of the Western world coming together and understanding along with the developing world.
We have a grand infrastructure development plan and manufacturing plan in the book. So we talk about a 33 program, learning from the American military how they manufacture the products in locally. So we talk about creating 33% of all essential supplies, including healthcare supplies, need to be manufactured locally. We talk about rest 33% manufactured somewhere in the country, and then the remaining 33 could be sourced anywhere in the world. Imagine an FDA approval of a drug or a device for that matter comes with a mandate that within the next few years you will have to manufacture 66% of your approved product for US distribution to be locally manufactured. We will not be begging other countries for essential medicines, gloves, masks, ventilators for that matter, and we will be supplying the entire world of it. So, few tweaking of way we do things will change the way we face the next pandemic, and we won't be begging anyone else. We shouldn't be. And this can be complicated.
Thank you, Dr. Chalil and Ambassador Kapur. Beyond the COVID-19 pandemic, widely available on Amazon, and my special thanks to my guest host, Dr. Ashna Parti.